Hi everyone, my name is Marion Monk. I'm a medical retina and uveitis specialist in Bern in Switzerland. And it's a great pleasure to give you a brief update on the LIGHTSITE III data which I presented at AVO this year. So the LIGHTSITE III trial was a multi-center trial which was done in the US. And it evaluated multi-wavelength photobiomodulation in intermediate AMD patients using the Lumithera Valida light delivery system. 148 eyes of 100 patients were included. Patients had intermediate AMD with either drusen maculopathy or non-center involving geographic atrophy. The visual acuity ranged from 2032 to 2100, and patients received in some 6 rounds of the photobiomodulation treatment, so every 4 months. The primary endpoint was best corrected visual acuity, and at 1 year, the visual acuity improved by mean of 5.4 letters compared to baseline, which was statistically significant compared to the sham-treated group. And after 2 years, the visual acuity increase was maintained with a mean of 5.9 letters compared to baseline, and this was also highly statistically significant compared to the active sham group. Also very interesting, the morphological data, because here we have seen that in terms of drusen volume, which was similar at baseline, the sham-treated group actually showed a threefold increase in the drusen volume compared to the PBM-treated eyes, and after 2 years, actually, the drusen volume in the sham-treated eyes were 4-fold higher compared to the PBM-treated group. And also very, very important, of course, the progression to late-stage AMD. So when we had a look at the onset of new GA development, we saw that there was a statistically significant difference between the two groups. And at 1 year, for example, 10% of the sham-treated eyes had developed new onset geographic atrophy and none of the PBM-treated eyes. And after 2 years, 24% showed new onset geographic atrophy in the active sham group, and in contrast, in the PBM group, only 6.8% had developed new onset geographic atrophy. Also, the progression rate from iRORA to CRORA, which is from incomplete RP and autoretinal atrophy to GA, was much higher in the sham-treated group. So, for example, after 2 years, nearly 68% had progressed from iRORA to CRORA in the active sham group, but in the PBM group, only 29% of the eyes had progressed from iRORA at baseline to CRORA after 2 years. So I would say in some very encouraging results, very encouraging morphological data and anatomical and functional data supporting that PBM can be reliably used in intermediate patients with age-related macular degeneration. Thank you.